Good afternoon. Thank you, Sonendo and Team Sonendo, for giving me the invite. And here I am to give a booth presentation. Special thanks to Marina Woloshin and Amanda Sekiguchi for their seamless communication and for making the event happen. This is just a noble intent of mine to bring it all home. As you can see, the topic is the Picasso principle. Um, just a disclosure slide. I am a consultant for Sonendo, and I've been so since 2018, and I am receiving an honorarium for this presentation. Just a brief intro. I've been practicing clinical endodontics since 1992. That's 32 years in the Washington, D.C. metro area. Our practice comprises three offices, one in the District of Columbia and two in the state of Maryland. I'm in practice with 5 professional partners, providing gentle wave on every tooth 6 years now to date, since April of 2018. We are proud owners of 1G3 and 3G4s, and to date, we have successfully completed almost 15,000 teeth, and it's just the beginning. All of us in our practice are more enthused and energized than ever before. Well, Maestro Picasso broke from convention and traditional norm to become one of the most influential artists of the 20th century. His artistic accomplishments were not only revolutionary, but they were innovative. And his principle applies beautifully to our wonderful specialty of endodontics. We are experiencing or have experienced a paradigm shift. I can best describe the shift in this one slide. We're now securing glide paths for our irrigants to follow and not for our shaping files to follow. We are, for the first time ever and routinely, emphasis on the word routinely, seeing Sir Walter Hess's benchwork chairside. All of us are familiar and have seen these breathtaking images published in his book over close to a century ago. We're now seeing Walter Hess's work chairside thanks to GentleWave's breakthrough and innovative mechanisms of action. I like to start by saying that the GentleWave procedure begins inside the console, where the irrigants are thoroughly degassed. Ladies and gentlemen, obstructive vapor lock is real. Degassing eliminates the fluid's dissolved air content, which enhances, promotes penetration, circulation, and flow of our irrigants into the more inaccessible or more unreached portions of the root canal systems. It is, in fact, anatomically blind in that it will clean whatever tight spaces present themselves. GentleWave excels within fine spaces. Walter Hess, by the way, Nobel Prize winner in physiology in 1949, he spoke about the enemy within. These are images he published in his marvelous textbook, exhibiting what he saw, I guess, for the first time ever, in between the mesial canals of a lower molar. We're now replicating his work again routinely. Chairside, this is just a phenomenal case by professional partner Scott Hetz, exhibiting multiple areas of confluent isthmi or transverse anastomoses. Take a look at this one case with multiple intercanal loops, and the one on the far right. I'd like to get your attention here. The 2 cases on the right are vital teeth. Let me tell you what's not within these systems: tightly packed, irreversibly inflamed, spongy, rubbery, and horrible collagenous tissue. GenOwave evacuates, dissolves the contents optimally, and makes these systems available for 3D obturation. Some of you at the booth, had the opportunity or you can have the opportunity to scan this code. Many of you do follow us on Instagram. Some of you uh, share our cases, and it is phenomenal what's happening on Instagram. If you scan this code, you'll have the opportunity to see hundreds, many hundreds of cases we have performed in our office using this breakthrough technology. Endodontics has become much less labor intensive. The procedure removes anxiety, worry, and stress. We are, no longer driving shaping files tool length through multiplanar curvatures. This is what I personally do in about every single case. Take a look at this 28 millimeter beauty. We use a 10 file. I use it number 10 to confirm available space to capture an electronic apex location reading, secure the glide paths with a mechanical 1602, build the platform. 10 file, glide path, platform. It takes about a minute and a half or so to build the platform. And now we are ready for the dance. This is a picture of my own mother. Every time I run GenOwave, I remember my mother, who's still around, she can play the castanet. She played when she was a teenager and in her 20s, making a living dancing in the streets of northern Spain and southern France. It is a dance. What's happening is the console is delivering about 400 cc's of optimized, that's degassed, and constantly refreshed advanced chemistry irrigants, which circulate within complex internal spaces within a closed and negative pressure environment during 8 nonstop minutes. And it doesn't have to be 8 minutes. But why would you not run the 8 minutes? We always run the entire cycle, and it doesn't have to be nonstop. You can stop and resume anytime you'd like. This is the pack. Let's zoom. We can observe, an area of apical bifidity, perhaps a transverse anastomosis, and definitely right up here, a furcation canal. This is a case that I did perform in one visit. I would have never treated this case pre-GenOwave in one visit. These patients come back. They are asymptomatic, doing fine. Their teeth are in occlusion and functional. Let's take a look at this other case. We call these apical chambers, which are loaded with Avogadro's number of bacteria. These are 10 files placed to length. Length is about 1.5 millimeters short of terminus, according to GenOwave protocol. Notice how the mesial canals merge apically. We are going to secure or own the paths, again, with a 1602 mechanical instrument, build the platform, run this cycle, and 8 minutes later, we are packing the system in 3 dimensions. 8 months down the line, this patient comes back for another tooth, and I snatch a recall radiograph. This patient is happy, her toothache's gone, and this is a keeper, hopefully for a lifetime. We are now discouraging needless shaping iatrogenic events. We are no longer driving shaping files through areas of curvature, recurvature, and recurvature. There is no chance that we are driving shaping files to length in this tooth. No chance. We are no longer fighting these teeth. We are owning the glide path and packing the tooth. It is just interesting how in cases like these, we are working much less harder to achieve a much more appropriate result, both biologically and clinically and anatomically. We are preserving maximum precious pericervical dentin. High five for that one. Superb tissue dissolution and surface disinfection. Instead of removing the infected dentin, we are removing the infection from the dentin. It's like we don't want anything touching anything in there. It is efficient. It takes less time to perform the endodontics compared to pre-GentleWave. Think about it. We are no longer shaping canals, and we are debriding and disinfecting them simultaneously. All canals are cleaned simultaneously. It's wild how it works. The larger the number of canals, the less time it takes to perform the endodontics. It is a productive and profitable technology. And let's talk about this because some things are important, and this is one of them. 85% reduction in file costs per year. 10 file, I've gone a bit smaller now as of recently. Glide path with a 1502 instrument, and that's it. With what, let me go back, with what I save personally in shaping files every year and a half, I can purchase a brand new G4 console every year and a half. We do charge a materials fee, in quotes, of $175. Less than half of it goes to taking care of the consumables, EDTA, sound seal, and the procedure instrument, which we tell patients it's used exclusively for them. It's a one-time use. A bit more than half is pure profit. Referrals, we are getting them from patients directly. They look us up on the internet. They know or heard about GentleWave, and they come to us because we provide the technology. Patients are referring their friends, family, colleagues, and loved ones. A significant number of referring dentists who we try to work with for years are now referring to us because they know that we are providing this technology for their patients. How about millennials? The largest generation in the US, 75 million millennials in this country. They are fascinated, millennials, fascinated at the tooth console connection. Many of them, they are taking images of the console and posting their root canal experience on their social media platforms before they even leave the office. I have received more referrals from millennials in the last 6 years than from similarly aged patients in my previous 26 years of practice. And this is where the math gets, well, important. Pre-GentleWave, 70% one visit clinician. I'm approaching about 100%. This is about a 30% increase in billable visits every single year. We're able to give our word to every canal in visit one, each time, every time, and all the time. Yes, it is profitable, and maybe I should add the word darn. Yeah, is darn profitable. And I will leave it at that. Take a look at this case. This patient came in swollen like a chipmunk. The sinus has been breached. The cortical plate at the buccal aspect has been perforated. This is what shows up a fraction of a second after we pop into the chamber. This is basically a geyser of pus. This is my glide path file to secure the canal, loaded in pus. Oh, I am doing this root canal treatment in one visit. Every time, each time, and all the time. This is a one visit endodontic treatment right here. We're going to build the platform. This is your clean flow instrument. You can see through the flow view window, the jet stream striking the impingement plate at the terminal end of the sound bar. There's a reason why the console has a waste canister, in its trunk, if you will. It captures waste. And this is where the waste ended up going. This patient had visibly reduced swelling after 8 minutes. No incision and drainage. We call these root canal floats. This is the pack. Nothing sexy about the operation. My eyes want to see a trifidity. Maybe it's there, maybe it's not. What matters here is that after 8 minutes, we have a canal that is pristine, clean, and bone dry. These patients come back asymptomatic, doing just fine, happy that we were able to preserve this tooth that is carrying this multi-unit bridge. Notice the marked reduction in the periradicular area of breakdown. This sinus membrane is back, and importantly, we have full regeneration of the buccal cortical plate. In cap, not caps, in bigger font, highlighted and in bold, almost non-existent post-op issues. Perhaps this is the most important and lasting benefit for a clinician like me. I've been practicing for 32 years. Let me tell you what happens after general wave endodontics. Well, basically nothing happens. No issues of just rock bottom flare-ups, persistent sensitivity to biting pressure, percussion. Patients rarely will come back saying, "Doctor, my tooth feels better, but it still bothers me when I tap on it," and so on. "Why is my gum still tender?" and so on. Interestingly, our own receptionists noticed that patients were not calling back after general wave treatments. They were not walking unannounced through our doors because they were having persistent problems. I don't mind, at this point in my career, I don't mind retreating a tooth with 5 posts and 9 broken instruments. I've been trained to do so. But I just don't want to be bothered by patients coming back post-treatment with problems. I just don't want to be bothered, and I am no longer being bothered. Perceived faster healing. Is it because we are cleaning differently? Maybe because we're cleaning optimally. Maybe we're cleaning more effectively. It's all semantics. We're definitely cleaning better, right? It's an innovative technology, and innovation is about doing things better. Faster healing because we're perhaps decompressing these bony cavities that are loaded with inflammatory elements or just infection. We're decompressing them thanks to general wave's mechanism of action. Remember, it is a negative pressure system. Does it matter that patients are healing faster? I don't know. Maybe it does. Maybe it doesn't. But I'll tell you this. Every patient we treat would rather heal faster than slower. It's really hard to measure success rates. We guesstimated pre-general wave during my 26 years of practice that our success rates or mine were about 93%. Just a guesstimate. How higher is it now? I don't know. I don't have a number, but I know it is higher, and to us, it is significant. I'd like to close by a quote by Maestro Pablo Picasso, which states the meaning of life is to find your gift. The purpose of life is to give it away. This is our gift, the console, the G4, that we provide our patients. A sketch by Picasso comes to mind every single time. I like to think of a angry tooth, a painful abscess tooth, as the bull. And then we've got the bullfighter, the torero. That would be the G4, ready to confidently tackle the task at hand. This concludes my presentation. I'd like to thank Sonendo and Team Sonendo for letting me be with you. Some of you may scan this code if you're feeling lucky and to win big. And having said that, I'd like to wish everybody a safe trip back home. Thank you.